Okay, this is going to be a how-to change a G-tube button. Our model today is clay. Um, yeah. First, I'm going to show you everything you'll need, or what I use to change this button. Uh, it needs to be changed. Doctor's orders are every 6 months. I do it myself. I'm pretty comfortable. Sometimes people just take their children back into the doctor. Either way, this works for us. But so your G-tube button will come in a box like this. His is a 14 French 2.0 centimeter. 14 French is obviously the width of the diameter, and the 2.0 centimeters is how long it's actually the length that's going into the stomach. So when you open it, it could differ, but this is what it'll look like inside. You'll have a syringe for the balloon valve, a couple of extensions, a Mickey extension, and a bolus. You'll have the actual G-tube button that you'll be replacing, all nice and new. And a couple of extra things that I use. Of course, I have clean hands anytime I do this, but I also pre-clean the area before I take his button out, which I'll go over that. So you'll want some alcohol. You can have, if you have swabs or if you have cotton balls and alcohol, it's fine. I have his extension I've been using. Like I said, it comes with one, but I just grab the one I've been using and I save that as like a spare. Filtered water. I grab another, well, I guess you could use the one in here, but that's just to check to make sure everything's flowing through. And then I have a second 6 ml balloon syringe, and I'll show you why. Some kind of lubricant of your choice. I'm just going to use chapstick. You'll see, I'm just going to put a little bit around to kind of help the new G-tube button in. And yeah, I think that's it. So let me get set up here. Okay, so I got as close as I thought I could. So first thing I do is I take the little alcohol pad and take that out, and I'm just going to clean around the button since we're going to have lots of stuff going on. And a lot of times, see, there'll always be a little bit of discharge. That's normal. A lot of times the doctors will recommend what they call a T-sponge, which is like gauze, special gauze cut to go around the G-tube. He was getting a lot of granulation tissue, they call it, and his skin just didn't look good. So I discontinued using those, and his site has always looked beautiful. I always get compliments. I kind of think that the T-sponge in a way holds bacteria and that drainage at the area, and that's what sometimes causes a lot of complications. Just my thoughts, because I know that once I discontinued using them, his site got a lot better, and now all I really need to do most of the times for care is take a baby wipe and just clean around it really well, and then he's good to go. So now that that's clean, I'm going to take one of the balloon syringes. Now this is, you will see a BAL. Let's see if you can. You'll see a BAL marked right here. That's for the balloon, and there's a little valve in there. You'll see that. But when you insert the syringe in there, it opens the valve, and then it allows you to extract that water from the balloon that's holding it in there now. So as you can see, there's about 5 ml in there right now. Oops, sorry. There's about 5 ml in there right now, and that's pretty normal. I usually put 6. Sometimes, there's some water loss. So now we're going to get ready to pull this out. Now the next thing you should do, or you should probably already have your button ready to go, and your whatever lubrication you're going to use. And I'm going to put a little bit on my finger, because once I pull this out, I'm going to grab these gauze too. Once I pull this out, it's going to look a little scary, and it might even be a little hard to tug out, but that's okay. You'll see that he has the hole there. That's okay. Just make sure you're cleaning it And then I'm going to put a little bit of chapstick around that area, just to kind of, like I said, kind of help the new button in. So you can see the difference here. Old button, new button. And that's perfectly normal, I was told. It's just fine. So now you're going to take your button, you're going to put it into the hole, and you're just going to slowly push it in. I mean, you can see he's not moving at all, no discomfort, nothing. It's totally normal. And then it's in. So while that's there, I leave that there. I grab the other 6 ml syringe. Now, when I do this, I go ahead and I put 6 ml back into the balloon. That's just kind of what we've always done. The doctor's fine with that. Some people's doctors may only say put 4, some may only say put 5. Ours said 6 was okay, so that's what we do. So you're going to reinsert that into the ball valve, just like how when you extracted it. And now you're going to slowly push that water in. And there's probably going to be some resistance. See, that's okay. It's just a brand new balloon. And then that's it. I kind of turn it like that, and that's it. Very simple. Everything looks good. Now I want to check, like I said, you want to check to make sure everything's flowing right as well. So you take that off, you insert your Mickey tube, and you have your water over here. I draw up a little bit of water, about 30 or so ml. Doesn't have to be perfect. Put that into the little port. And now we're going to check that everything is flowing right. And as you can see, everything looks good. Water's going through easy. And that's it. I know it's scary, but it's pretty easy once you've done it a few times. Like I said, a lot of people will still take them into their doctor, but next time you go, ask the doctor if they will guide you through it. So give it a try. Maybe the next time you just get it from your DMA company and you change it right at home. It saves you a doctor's trip. Anyway, you can see he's happy. No discomfort. Nothing to worry about. All done. Thanks.